Welcome to the Birth Protectors Podcast. I'm Rahelios.
And I'm Celeste, and we are bringing in a father's perspective on home birth.
Hello. So Celeste and I just finished listening to a podcast from a licensed, registered OBGYN who's attended many births, of course, and basically she was giving what was intended to be a very balanced perspective on the risks of having a baby at home versus having a baby in the hospital. Now, the reason why I paused is because she was actually only talking about having a baby at home with a midwife. She never once even brought up the idea that there's people having babies at home without any medical attendance, because that's probably so far outside of anything that she considers sane that she didn't even mention it. But that really kind of is part of the point and colors the whole situation.
Yes, because she's talking about all these statistics, versus home birth statistics and hospital statistics, and comparing them. But this home birth data is all data from midwife attended home births. So there's this whole other section of home births that don't have any representation in this data. Therefore, the data is incomplete.
Right. So basically, there was some definite interesting things there. One of them is that she repeated over at least 10 times. She said, what I want to make clear is that the absolute risk of anything going wrong, whether you're home or whether you're in the hospital, is actually very, very low. Those were her words over and over again. So coming from an obstetric OBGYN, she was literally saying that what everyone needs to understand, and I think this is a huge thing because people aren't getting this, is that overall, the risk when you're having a baby, the risk of something going wrong is super low. Like, it's just statistically proven. For some reason, we're led to believe, it seems like, through the media or through the medical establishment, or I'm not sure, but it just seems like we tend to be led to believe that birth is a very risky thing and that it almost always has complications.
Yeah, it's portrayed as such this emergency situation, like almost every time.
Yes. And so that's why you should definitely have your baby in the hospital, and it's crazy to consider having your baby at home or whatever. And here's an OBGYN who was saying, like I said, she said it probably 10 times, that it's just the absolute risk of anything going wrong just inherently is very, very low. Whether you're at home or whether you're at home with a midwife was her presentation, or whether you're in the hospital with a midwife, or just in the hospital, just standard. Now, my take on that, though, is like, okay, so that is great and that is true, but the reality and the reason why we have chosen to have birth at home is because we consider it to be safer by many, many orders of magnitude. Now, okay, let me back up a minute. At one point, she was like, what are the reasons people choose to have birth at home? One is because, they just don't have access to good health care. Another one is because they actually have a fear or a distrust in the medical system. And they actually, so they're choosing for safety reasons, that they actually think that it's safer to have their baby at home. That was kind of how she started her podcast. And we would fit in that category. Definitely.
Yeah. Definitely wasn't lack of access.
No. We're in the United States. Everyone has access to medical care. It's because, okay, I'm trying to draw the connection. So where she's saying that it's the very risk of anything going wrong is very, very low, whether you're home or in the hospital. But basically her overall opinion is that you're still much safer in the hospital. Well, I feel the exact opposite, and to a huge degree, because the fact is that if you go to a hospital, there's all kinds of interventions that are definitely going to occur, and a whole bunch of other ones that are likely to occur, and then a whole list of other ones that could maybe occur. But the chances that you're going to go into a hospital with zero interventions is zero, which means there's going to be interventions, and those interventions cause negative things to happen.
Yeah.
And they always include trauma to mom and trauma to the baby. Every time. And to varying degrees, from really bad to really, really bad to extremely, just sickeningly horrible.
Abuse.
Yeah. From my perspective. And so when you look at, okay, well, which is safer if the chances of anything happening bad are really, really low? Well, that's because they consider the outcome of a birth in a hospital, as long as the baby's alive and the mom is alive, they consider that a good outcome. Like that was a positive outcome.
Yeah. So yeah, that she basically said that, like, um, that your chance of having a good outcome, whether you have a home birth or a hospital birth, is about equal. And I disagree with that very much, because, this whole idea that just because your baby is alive, that's a good outcome is very wrong.
Well, yeah, it's absurd oftentimes, because like, well, you get these women that will go in there and have an epidural, for instance, and then they'll say, "Oh yeah, my birth was great. I didn't feel a thing," and the reality is they were completely brutalized, completely traumatized. Like, if they would have been conscious and, or well, have all of their nervous system intact during this experience, they would not at all be saying that it was a good experience. I guarantee you. And besides that, more importantly, is the baby. Just because mom can't feel anything, that baby is feeling everything. That baby is being traumatized, brutalized in horrible ways, oftentimes maimed for life. The
number of birth injuries is astounding.
It's completely astounding. Like, you don't realize until you start to realize. Like, I see people all the time, and you'll see like one of their eyes is kind of droopy, and over, like, that is the scar of a extremely brutal forceps delivery on this poor baby.
Mm-hmm.
And now they're doing vacuum extractions, which are super just ugly, brutal, and painful to the baby. And you don't even see those scars most of the time. It's like a lot, the new technology, it's great. And I mean, I'm telling you, these vacuum extractions, well, why don't you tell the one that you witnessed live in person?
Yeah, that was very traumatic to witness. And
so what is it actually like? You think, oh, they just pop the suction cup on the baby and it just pops right out,
it's
right?
a whole lot of force, and the suction cup will pop off and oftentimes tear the baby's scalp. And yeah, it's really awful.
We're not talking like little tears, like, oh, look, there's a little cut there. We're talking like blood gushing everywhere.
There's all range of things. And this doctor even mentioned the fact that here in the United States, our mortality rate is actually very high compared to other countries. And so that tells you a lot, because we have access to more medical interventions, but it's not giving better birth outcomes.
No, really. And it's interesting. So This is actually our second attempt at this podcast, by the way, because the first one we did is a reaction video where we actually played her video and paused and reacted to it because there's so many things she said that are just interesting. Now, her overall perspective at the end, by the way, is that like I would never have a home birth. I would definitely have my birth in the hospital.
She
But
does. She does advocate for people being able to make that choice themselves, but
yeah,
yeah, she's definitely very biased towards like, you know,
and certainly you should have a midwife. But she said some really interesting things, like where a lot of the studies that were done were actually, the fact is that she was calling them lower risk. Like, well, the fact is that if you're at home, you have a much lower risk of a lot of factors. Like you have a much lower risk of episiotomy and a lower risk of epidural, a
lower
lower
risk
risk
of
of
tearing.
a lower risk of induction, a lower risk of, you know, there's this whole list of things that she was saying is a lower risk when you have your birth at home. And I'm sitting there going, lower risk? There's zero, like those things only happen because you're in the hospital.
Yeah. Well, I suppose if you're just comparing midwife attended home births, those many of those things do happen at home.
Right.
Although, like
Because midwives,
cesarean, like you're not going to have a cesarean at home.
right. It's like you have a much lower risk of cesarean in a home birth. Yeah, right. Like, oh my gosh. Now I'm having all these. I was about to say, whoever has a cesarean at home, and then I got these horrible images in my mind. But anyway, because it is a horrible thing. Actually, the first I had one baby before marrying Celeste, and that child was born in the hospital. It was a cesarean. My first daughter and I was there to witness the whole thing, and that is a brutal surgery. I mean, it's just like it's insane. Now they've gotten really good at it, and in cases where it can save somebody's life, okay, that's wonderful. Thank goodness that they can do that. They've actually gotten so good at it, though, that it's getting to the point now where a lot of hospitals and doctors actually would prefer, they won't tell you this, but the numbers and the statistics show that they actually would prefer to just have a cesarean because then they have total control, does away with all the yelling and the screaming and the, long drawn out stuff and all kinds of unknown things that could occur. Medical doctors just love a sterile surgical situation where they can just bring you in, knock you out, or, they actually can leave you conscious, but you just can't feel anything via the epidural. I mean, that's how strong these epidurals are. You literally have zero feeling down there because they can cut you open and you don't feel any pain at all. It's just a nice, in their opinion, nice clean surgery where they have total control of everything.
Well, and they have control of their schedule, and they also, by the way, make a whole lot more money.
Oh, yeah, massively more.
And that's one of the big things that people have to realize is that hospital birth is a business, and they, of course, are consider their, bottom line and their business, above all else. The people coming in are just, you're just one of many, many clients.
Yeah. Yep. And it's really inconvenient, for a doctor when you come in and then you want to have this long drawn out birth process and it's, they're looking at their watch going, oh my gosh, I was supposed to be at dinner at 6. And like this actually happens a lot, like way more than you think, by the way. If you could be in the boardroom hearing a physician's conversations, you'll probably be shocked. But in any case, there's all of these things that happen in the hospital that are anywhere from 100% likelihood that it's going to happen to, you know, lower percentages. Like a cesarean is, it's not 100%, obviously. Episiotomy is like probably 99%. And all kinds of other things, the cutting of the cord and just all the things that they do to your baby that they're guaranteed. It's a whole brutal thing. And the fact is at home, even coming from this obstetrician or this OBGYN, the statistics show that the chance of something occurring outside of those interventions, like with none of those interventions being involved, you leave all that out of the equation, and the chances of anything going wrong are super, super low. That's just the reality. They're not zero. So if you decide you're going to have your baby at home, you have to know that there is a chance something could go wrong. There are situations that are horrible and heart-wrenching where things
happen sometime no matter where you are. And that's life. I mean, that's just something that you have to accept as a part of life. It's like just being alive means that there's a chance you could die.
Like, getting in a car and driving down the street, actually, those chances go up huge. Like, it's like if you drive a car on a regular basis, the chances of you being in a car accident at some point in your life are very high, and the chances of you being injured are very, very high, and the chances of you being killed, in comparison to never driving a car, the chances of you being killed in a car accident are extremely high.
Yeah. And people don't give it a second thought.
Right.
Yet when you are doing something completely and totally natural that's like a bodily function, giving birth, they act like this is like so risky, when in comparison is very, very, very low risk.
Yeah.
So
now you might think, okay, well, of course you're going to say that because you guys are home birth advocates and you could just be full of it. Well, that's why I was interested to listen to this podcast. And Celeste, you were just telling me about another one. Why don't you talk about that?
Oh, well, yeah. So I listened to another podcast recently where this doctor was interviewed that he, went through the whole medical system, and him and his wife had their first baby in the hospital, and they actually had a, quote, positive experience.
Is this doctor, was he like a delivery doctor?
Yeah, he was an OBGYN and, delivered lots of babies. But anyways.
And let me just, because I just learned this, when she says lots of babies, I just learned this from this lady's podcast that we just heard. Like they go to, 4 years of medical school, then they go to 4 years of obstetrics. And in that time, then they have to have internship, like 4 years of internship, where they have to participate in a minimum of 200 births before even leaving their internship. So when we say a lot, I mean, we're talking like thousands. Even if somebody was like, oh, I've only been a doctor for a year, let's say, and you'd think, oh, they probably didn't see that many births. No, if you've been a medical doctor practicing for a year, you've seen hundreds, at minimum, hundreds of births.
Mm-hmm.
So how long was he practicing?
I don't know. I don't know those details or don't recall them. But the interesting thing is that, he totally ended up stepping away from that career and everything, and realizing how much the medicalization of birth is, how damaging it is, and how it's taking away from the experience and what it should be. And
so are you saying he stepped away from being a medical doctor because of the things that he saw going on in standard medical practice during childbirth?
There was a lot more to it. I don't remember all the details, but just you know, coming from another OB doctor who has totally like awoken to realizing how much brainwashing he went through, and the fact that he's like totally come around is just very interesting.
Well, so he has totally come around. Like, what was he saying?
Well, and so their second baby was born at home, and even though they considered their first hospital birth experience a positive one in which they had, some control over and were able to like, delay the cord cutting and certain things like that. And it was a positive experience. He talked about in comparison to their home birth that it was a drastically different experience. And he advocates for home birth now. So that's just very interesting.
Now, what do you mean he advocates for home birth now? Like he did one interview?
No,
Like, I mean, tell like this guy's like actively out there talking about this on a regular basis, right?
yeah.
Telling people, this is not a small detail, Celeste. Like, this is a medical doctor that used to be an obstetrician, used to deliver babies by the hundreds or thousands, however many he delivered, and realized, holy crap, this stuff that we're doing here, this is not good. And like, he's not even practicing medicine anymore. And instead, he's out there putting his reputation completely just out the window because all of his colleagues are like, you're nuts. Like, whatever, you've gone off the deep end. He's like, whatever, no, I'm telling people the truth. And the truth is, there's so many things wrong with what's happening in the hospital. And
the procedures and the policies
and he's out there advocating for home birth. Who is this doctor so people can look him up? I think he'd be a great person for people to listen to.
Like I said, I didn't remember the name. That's why I was not going into specifics.
Well, yeah. Well, you could probably find this guy. Maybe we'll come up with the name and put it in the description or something. But, and gosh, it's rare for a medical doctor to completely flip-flop like that because they go through so much training and indoctrination in order to have a medical practice. And once they have that medical practice, of course, you've gone through all that school and all that training, and you believe you're doing the right thing. And if you go against it, you can't continue your practice. You have to give up your license if you decide, hey, I don't think we're doing this right. I think we should do it this other way. It's like, well, okay, fine, but you can't be a doctor anymore. So you just you'd have to, these doctors that turn away literally give up everything that they've worked for and studied for in order to become a naturopath or whatever other path they choose. And I'll tell you, being a naturopath, you're not going to get paid anywhere near what you would get paid as a medical surgeon. So it's not a decision that gets made very often for all those reasons. They don't even want to look at it. Yeah. Like they'd rather, it's like, cover my eyes, cover my ears, la 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 la, I'm not listening. Please don't tell me that what I just put my whole life into is wrong. Like, I'd rather not know. And that's very, very common, very often the case. And this is why you can't go to your doctor, ask your doctor if home birth is right for you. It's like your doctor is not going to tell you, oh, sure, it's a good idea. It's, perfectly safe or safe at all. Or, yeah, that's really rare. It is becoming more and more normal, especially with a midwife. Certainly, you can find OBGYNs that'll tell you, well, if you find a good midwife, that it can be a okay choice, right? I mean, the doctor that you saw with our first baby or two was actually, well, how did that go? How did those doctors, because you saw a medical doctor for the first couple of pregnancies, right?
Yeah.
So talk about that.
So the first one never told her our intention to have the baby at
Yeah,
home.
we didn't even tell her.
It was just like we just decided to stop going to appointments and drop out, and that was that.
Because it was our first time, and we were like, it was just avoidance. We didn't want to deal with the confrontation and listening to her try and talk us out of it. So I'm not saying that this is what you should do. We're not advocating for that. That's just what we did. I forgot about that.
And so, and then our second baby, it was prenatal medical care consisted of one single visit, where I just wanted to find out like how far along I was. I had no clue, like when we got pregnant, and
because it was a surprise. It was so early.
Yeah.
Our second baby was exactly 1 year, born exactly 1 year to within a week or 2 weeks of our first baby.
So yeah, I got pregnant and didn't know because it happened so soon that I wasn't having periods again yet. So I wasn't having periods. I wasn't expecting a period. And so it was several months before I was like realizing that I was pregnant. And because I didn't have my last period to go off of, I had no idea how far along I was. So anyways, I went to one visit and, they measured, the height of the top of the fundus and gave me an estimation, which by the way ended up being a whole month off. So that's how accurate that is. But in any case, that was all for that pregnancy. But for the next few ones after that, it was a certified nurse midwife that I went to for prenatal care, and ended up regretting that in the end. But
yeah,
because she was very supportive in the beginning. Like, okay, I told her like I have my babies at home, and she was like, okay, and she was actually okay with that, even though she was like, well, I don't attend home births. I only deliver in the hospital, but I'll be here for you for backup. And so, I thought that was great that she was willing to be there as backup. And so, but with the last pregnancy that I was seeing her,
which was not our last pregnancy. Like we stopped seeing midwives and all that.
Our baby was 42 weeks, and so overdue by their standards by 2 weeks.
Was this Guy or
no, Avi? And so went in to just get one last checkup, and she's like, "Oh, you're still pregnant," and made some comment about we just need to get things moving or something. And completely without consent, she did a stretch and sweep of the cervix and induced my labor, which was completely
which means
violating.
Like, she just stuck her fingers up in there and like just popped the membrane or whatever.
And
that
completely without consent. And I did not realize that happened because, she didn't say she was doing it. Like, nothing was discussed, and it wasn't until later, until putting pieces together and finding out that she did this to other women on a regular basis. And
it's just standard procedure. Oh, well, we know how to get this going. And then,
Yeah. So.
Oh my gosh, that was
very violating. And
I was infuriated to realize this.
And I have since learned this is quite common, that, women just go in to get a check, just to check the cervix, and the medical provider just does the procedure without consent. And there are a lot of risks to it. And
well, it's not a procedure. You're causing damage. You're going in there and causing injury, which causes labor to spring into action in some cases because you've went in there and screwed things up.
Yeah, it's an intervention and it has risk. And
it's not natural, it's damaging. It's like, yeah, there's risk. There's all kinds of risk. It's like your baby was not meant to be born yet. It's not like babies are not meant to be born on a calendar date.
Yeah.
That is not how this works. Your baby, when it's time for your baby to be born, your baby's going to be born. It's like they don't just stay in there. They go, oh, this is like, they don't stay in there. They're not going to, it's like, oh, it's been in there for 43 weeks. Oh no, this is horrible. Something horrible is going to happen. Like, no, that doesn't happen. And they tell you all these things about, oh, well, the placenta could go bad and all this stuff. They're basing it, I don't even know what they're basing it on, because they don't have a bunch of studies of birth, of labor, or, pregnancies that have gone over 3 weeks over, 4 weeks over, 5 weeks over, because they don't ever allow that to happen. Where are they doing these studies when it's never allowed?
Yeah. So whenever I see these statistics about that say like, oh, 40% of women go into labor by 40 weeks and 60% have gone into labor by, like
earlier, probably, because they induce it
by
earlier.
41 weeks or whatever. So like these statistics are based off of hospital births, which they don't allow to go past a certain time. So
yeah, it would be medically unethical according to their practices to allow it to happen. So they can't do a study on it because they can't even allow it to happen.
Yeah, so.
And the fact is, though, that aside from, so they always induce at that point. Well, if they didn't, these babies would very likely, okay, we're not medical doctors. This is just based on our own experience and things we've observed in our own births and other people we know. Your baby is fine, and if it chooses to be born later, I don't know if the baby's choosing or your body's choosing, whatever, choosing is the wrong word. When the birth process is ready to be complete, it will happen on its own. It's like natural. When the baby is
fully developed, they release a substance in their lungs that triggers labor. They've like recently discovered like that this is like happening. So it's like the baby determines when labor is going to happen for the most part, when they're fully developed.
Yeah, it's based on the baby's development. It's not like some conscious decision that the baby decides, but now, as far as we know anyway. But
there are, physical things that could, not physical, emotional, I guess, things that could actually, if the mother senses that she's unsafe, the body can actually hold off on starting labor, even if the baby's ready. Like, so there are times that, if you're not going into labor and you look at what's going on, it's like if you're super stressed out about being overdue, for instance, that could be prolonging the pregnancy unnecessarily.
Well, sure.
So,
but
for the most part, the baby's going to be born when it's ready.
Well, yes, and I think more importantly is to realize that because of that, you should realize we should realize that if your pregnancy is going past the quote due date or whatever date that you've predicted it's going to happen, or your doctor or your midwife or whoever, it could be because it needs to. It could be because you're off on your prediction too. That happens all the time. But it could very well, most importantly, it could very well be because physiologically, in some way, the baby is just not fully developed. And if that birth would have been forced to occur unnaturally, which is what happens in the hospital constantly, it could lead to other complications because the baby wasn't ready to come out yet. And that's why it hasn't tried to come out yet. It's like that simple. So if your labor hasn't occurred, that's not time to start panicking. Oh no, something's wrong. It's just not time yet. That's all there is to it. It's not like it's fine. How many of our babies went over and how far over did they go since we're on this conversation?
We had one at 18 days past 40 weeks. It was 42 and a half weeks. And one at 43 and a half weeks, almost a whole month longer. So, and we've had, every range in between. So I truly believe that, babies are all different. They grow at their own rate.
Yeah, and there's all kinds of things going on in there that we wouldn't really necessarily be able to measure, even if we're trying to. Neurological things happening in the brain and the nervous system, just, cellular biology that's at the microscopic level. There's genetic things going on. It's like it's a system, you know, divinely designed or naturally designed or evolved or however you want to believe it or think about it. It's been perfected, and it's not something you should just go in messing with. And so the medical establishment that just regularly, in its arrogant attitude, will just go in there and intervene and decide, oh, we're going to do this baby early, or this, it's time, or let's induce this labor. Like, they're causing so many problems. And so the standard medical practice, at least in this country, the United States, something you go into your doctor and something's wrong. It can even be obviously physical. Like, I remember going into the doctor one time because I had like pain in the back of my neck that had lasted for weeks. It was a strained muscle or something. This is when I was pretty young. Anyway, and so I got concerned. I was like, why is it still hurting? So I was like, I'm going to go to the doctor. And I hardly ever went to the doctor even back then. Now I never do. But so I went to get it checked out because I was like, I feel like something's wrong back there. Like, this, it's been weeks and it's been hurting. And so I'm describing the pain to my doctor, to the doctor, whatever. And after I got done, he picks up his pad and starts writing a prescription. And I'm like, so what are we going to do? And he's like, well, here, take 2 of these and in the morning and 2 at night and you'll be fine. I'm like, wait, I came here to find out what's wrong. Like, there's something, like, aren't you? You didn't even look, you didn't feel it. I was like, are we going to do an x-ray or MRI or something? Or even, no, just give you a drug. And that's how medicine is practiced here in this country. And every drug they give you has side effects. This is the point I was getting to, which lead to, what do they do then? They give you another drug, which has more side effects, which they then give you another drug. And this is usually how it goes. Probably everyone that you know that isn't into alternative health or whatever is on medications that they're probably going to take the rest of their life. And they always just add to it and add to it and add to it, always, because the side effects cause another problem, which they have another medication for, which causes 5 more problems, which they give you 5 medications for, until you're taking these entire bags full of medication. If you've ever seen old people, they've got these like grocery bags full of medication. And so the same thing happens in birth. You go in there, they find one little thing that's outside of the lines, and then they introduce an intervention. Oh, well, let's give Pitocin, which then causes another problem. So then they have another intervention, which then causes other problems. And they just stack on all these interventions until it's like all kinds of insanity happening, which they consider just a normal childbirth with a good outcome. Even though the mom's been brutalized, the baby's been brutalized and traumatized.
And then they tell you, oh, well, all that matters is a healthy baby.
Yeah. And this is not rare. This is just how it goes in the hospital. This is just how it goes. We watch video of babies being born, and it'll be playing like this nice soft music, and like, you're supposed to be like, oh, look at this beautiful process.
Like the miracle of birth.
Yeah, and you'll see, people standing next to us will be like in tears, like, oh, how beautiful. And I'm watching this, knowing that it's like all these unnecessary things being done to this baby. The baby will be like being manhandled and jabbed with needles and stabbed, and the baby's like screaming in pain, and it's just gut wrenching. You're literally watching physical child abuse on the most innocent of children there are, brand newborn baby, and they're abusing it, torturing it, brutalizing it, and traumatizing this baby physically and emotionally. In both cases, emotionally, these they'll be scarred for life, and physically, often they're scarred for life. And everyone just thinks this is just fine.
It's so normalized. It's terrible.
Yeah, and it's like, oh, that was a beautiful childbirth, and oh, like they didn't see anything going wrong there. And from our perspective, because we've had, we don't do that whole thing. You just realize, no, this is just a baby being unnecessarily abused, traumatized,
In their
and
first moments of
brutalized.
life, when they just need skin to skin contact with their mom.
And
And
meanwhile, mom, who's laying there bleeding and cut open, and all kinds of abuse just happened to her too, that she probably didn't feel because she had an epidural.
yeah, it's just so much trauma.
Ugh, it's not good. It's not good. We're just, that's why it's called the birth protectors. Not okay with that. Choosing, especially, as the man, choosing to protect your wife by having birth in your space, and maybe not more importantly, but absolutely as importantly, protect your baby. Like if your wife is like, oh, I don't care, I'll just get an epidural, I won't feel any pain, I'll be fine, I'll take painkillers afterwards. Okay, no, that's not okay, because your baby is getting abused.
Yeah, you need to consider the baby's perspective. And
Would you let somebody do that to your baby 2 days later? Like, your mom's home with your newborn baby in her arms. Would you let some guy come up and grab your baby out of her arms, strip its clothes off, turn it upside down, start whacking it, stab it with needles, cut it open, slice parts off of its body, all kinds of insanity with no... Oh, it's sickening. Like, from my perspective, it's absolutely disgusting, sickening, and I'm not okay with it. I'm not okay with it as a choice because it's child abuse.
yeah,
And it's so prevalent. It happens to all of us. It's literally screwing up humanity. It's part of the huge problem why you're born, and right away you're taught you're not in control. You don't have any power. Your thoughts, your decisions don't matter. You're just a piece of meat. Do what you're told. Things are going to happen to you.
yeah.
And
And
the world is traumatizing, and that's just life. That's what you're taught as soon as you're born. Every one of us.
separated from the mother. And
uh, well, so we went pretty far off of the podcast, I guess.
well, I mean, I guess that's what we're discussing in this episode is home versus hospital.
Yeah, which is safer. That was the initial thing.
That was the title of the video that we watched earlier. And so, yeah, that's our perspective on it.
Well, I guess I don't think we probably have left anyone feeling good at this moment, unless if you choose to take this birth into your own hands and say, yes, we're going to do this. Yes, we can do this. I definitely support you. I encourage you. Kudos. Good job, mom. Good job, dad. It's from my opinion, my ignorant, non-medical, I have no idea what I'm talking about, opinion is great job. That is a great decision. You're definitely doing the right thing, even though maybe you're in a situation where nobody supports you. And maybe if you're a mom and you're thinking this and you're like, yeah, I feel this, I don't want to go through that. Like, I definitely want to have my baby at home because it really is a beautiful, non-traumatic, gentle experience at home. It should be, can be, and it's absolutely beautiful. You'll be so glad. And if nobody's supporting you, if your husband's not supporting you, well, dad, you need to think like that's who this podcast is for, because all of those things we just described, like by you not supporting your wife, you are condemning her and her baby, your baby, who you should be protecting, who you would definitely protect once it's born. But yeah, but during the birth process, you're just going to allow all of this brutality and trauma and abuse to happen to your baby. Like, why would you do that? Because you think it's safer. That's why. I know why. I know why. I'm a man. Because we think it's safer. Well, that's just because you haven't fully thought about it in all these ways that we've just described. Like, really consider the fact that this, at the very beginning, like we said, it was an OBGYN who's been practicing for many years, who is stating at least 10 times, and she is not a home birth advocate, she's a medical birth advocate. But even there, she's trying to be balanced, and she's like, look, I've looked at the studies and everything, and I have to say the truth is that the chances of anything going wrong, the absolute uh, possibility of something horrible going wrong, is extremely low in any case. So you have to realize that's where you're starting from, you know? And car accidents happen. Gosh, but you don't plan to be in a car accident. When you get in the car, you don't, say, I better have a doctor in the back seat because there's a good chance we're going to wreck on this trip and he might need to sew my arm back on. It happens, and then, gosh, heaven forbid, get to the hospital. But that's not the plan. It's not even likely. But if you go to the hospital, all those things that we've just talked about over the past however long it's been are virtually guaranteed.
Yeah, and there are a lot of people out there, doulas and stuff, that, try to advocate for, if you just hire a doula, they can help advocate for you and help, your choices be honored in the hospital. And I really just feel like that they are setting people up for major disappointment, because it is very, very hard to go up against medical policy and to refuse something that is their policy. Like,
oh yeah, it's not only is it hard, it can be impossible. Once you're in the hospital, if they decide that this needs to be done, they will go so far as to, mom, they will physically strap you down and drug you and do whatever they've decided is necessary. And dad, they will take you out of the room and have you arrested if necessary, if you're being too forceful and belligerent in your opposition to their chosen path.
I mean, you do have rights, and you could even just walk out of the hospital and sign a paper.
Yeah,
they'll have you sign a paper saying that they're not responsible, and
yeah,
you can walk out.
If you make that decision before you're already in the stirrups and they've already sliced your vagina open, and you're bleeding all over the place, I don't think you're going to walk out at that point.
Yeah, for the most part, there's very little that you can do to influence the way things go once you're there. And that's not something that you want to be doing when you're in labor, is fighting for
right,
for your birth to go a certain way that's against what they want to do. Like, to me, that's just like, why would you do that?
Why are you putting yourself in that position just because you're afraid that something might go wrong? That's why, right? I mean, bro, like, that's why. You're like, I'm just afraid that something might go wrong, and I want to protect my baby, and I want to protect my wife. but it's fear.
Yeah.
And it's misplaced fear. Because the statistics show, even medical doctors, the two that we've just talked about, one who's pro hospital birth, the other one pro home birth, but both of them saying the same story, because it's just a fact that, contrary to what the mainstream thought process seems to want to implant into our heads, which
the conditioning,
the
we all
conditioning
receive,
is that birth is super dangerous and it's very likely things are going to go wrong. The actual reality and the truth is the exact opposite. It's the exact opposite. Birth is a beautiful thing. It's been designed, evolved, naturally occurring in order to be. That's how the human race propagates. It's not some traumatic rite of passage that you just have to go through and hopefully you live through it. Like that's what people think, and that's insane. No, that's not how it is. Don't.
Our bodies are designed perfectly for giving birth, and 99% of the time birth just works.
As long as you don't screw it up.
Yeah, if you don't screw it up.
Don't go in there screwing it up. You don't need to be sticking your fingers in there, introducing infection. You don't need to be screwing fetal heart monitors into the baby's skull. You don't need to be taking drugs. And oh my gosh, so many things. Like none of the things they do, those are all things you shouldn't do. In my opinion, my ignorant, non-medical, I'm not a doctor. Don't listen to me. I don't even know what I'm talking about. I'm just some crazy guy giving my opinion. So, that's my opinion. I happen to be a crazy guy who's had 10 babies. And they've been all kinds of crazy experiences, all end up beautiful. Which, by the way, from a doctor's perspective, they would laugh at the fact that you've had 10. Like they've had it over, I think I already said it. Yeah, 200 before they even leave internship. So 10 is nothing. But
they witness 200 plus medicalized, yes, intervention-filled births. Most doctors have witnessed thousands of those type of births, and quite possibly have never seen an undisturbed physiological birth unfold without any intervention. Like they don't even know what that looks like. So they don't, their mind is never even going to go there. Like
they would be floored.
That's out of their scope, their vision. Like, and it doesn't exist in the statistics either. So it's just, that's where it is.
That just reminds me of, we went to some kind of home birth group in Sedona one time. That was, I don't remember exactly what it was for, but anyway, we're in there in a group with several other couples. There was maybe 10 different couples, and one of the dads was he's a EMT, he's a fireman, and he was telling his story where he had seen lots of births in his time as a fireman and participated in them, and when they'd be taking a woman into the hospital and she starts going, giving birth to the baby before they get there, and they're taught to do all these procedures and things that they think they have to do. And when he, for the first time, witnessed just a natural birth just unfold, like he kind of described how he was like completely floored. He was like, but wait, now you have to, oh, and why aren't you, wait, oh, this is, oh, no, this is not okay.
Yeah, especially, he was stressing out about the fact that the baby hadn't taken a breath yet.
Yeah, and he was like, oh no, by now you should be doing chest compressions, and you should be...
He was panicking internally just watching that, and he was talking about how he realized that you don't have to panic if the baby doesn't take a breath immediately, and that he's learned
Well, yeah,
since then.
he kind of was relaying to us how he went through that whole process, and then looking back at those all those other birth experiences that he experienced, and realizing we didn't have to do any of that stuff. That was all a bunch of BS. And now
Yeah.
he's in here with his wife, and they're getting ready to have their baby totally at home, and he's just like, "Yeah, I'm totally over all that insanity." And this is an EMT fireman, he's dealing with trauma constantly. It's not like he's some
Yeah.
ignorant person.
Yep. So
Yeah, so it's
when you consider a medical professional's point of view, you have to realize where their point of view comes from. It's like they have lots of training in medicalized birth,
that's all
and
they know.
that's all
That's
they
that's
know.
all they've seen, and they've been told. What do they study? They study everything that could go wrong and how to deal with it.
Yeah.
That's
And
what they're studying and focusing on.
a lot of those things that
So
they think are so wrong aren't necessarily, but
yeah, they're not even wrong. And then a whole bunch of other ones that they think are things that go wrong are actually things that are caused by their previous processes, like we just described. One thing leads to another, which
the
leads to another, which leads
cascade
to
of
another.
interventions.
Yeah, and they don't see that. Like if you go in there talking to a medical professional about that, they'll like probably laugh at you and call you an idiot. But it's true. This is what occurs.
Yeah. It was interesting listening to that doctor's video because she was like, pondering like why home birth has such low rates of, all these interventions that, if you're in the hospital, they just deem these as necessary. And it's like, but, she doesn't really come around fully to
Yeah.
realize that as doctors, they are causing.
Right.
Like she never quite made that connection.
Yep. And that's the thing. It's gosh, at home it's such a different thing. It's especially specifically we chose to not have a midwife or medical person present because then there's nobody there trying to follow their protocol, feeling like they have to intervene, they have to do this or that, because midwives very much do. Like they can't just allow something to occur if it's outside of their protocol, and they just allow it to occur and they don't recommend and call an ambulance and have you transported. Now they're liable, and you could look in the news on any given day. I just looked today, and there are midwives being tried for crimes because of not taking action. So they can't just stand there and watch and think, oh, this is probably going to be okay. If they do, they're putting their future and their very freedom at risk. Never mind their profession, but their liberty. So they really have their hands tied, and you could do them a big favor by just not having them there. Again, that's just my crazy opinion. That's what we've done, and it's been wonderful because birth just is this amazing thing that unfolds that you get to participate in and witness and really just be left in awe of the beauty of the natural process. That's how it should be. And those babies come into the world without any trauma, with fully their autonomy still intact. They come out and they're like their first desire is, I want mama, I want to eat. They have an instinct, and immediately they're given the breast and they're fulfilled and they're held in mama's arms, they're held in daddy's arms. And
Yeah.
it's just absolutely beautiful.
They realize from the get-go that, that they're safe and that the world is a safe place, and they're going to be much more secure. And
Yes. And in that case, congratulations. You're now a birth protector. Good job, mom. Good job, dad.
protect those babies.
Yeah. So, okay. Well, hope you enjoyed and maybe got something interesting. And we'll talk again soon.